Before entering the room, the nurse verifies the healthcare provider's orders for wound care, then reviews documentation of previous dressing changes to determine the number and types of dressings used. The nurse enters the client's room, performs hand hygiene, acknowledges the client, introduces herself, and explains the procedure to the client, including the approximate length of time needed to perform the dressing change. The nurse will assess the client's need for pain control and administer medication as ordered, allowing time for the medication to take effect before beginning the dressing change. Prior to re-entering the room, the nurse will gather the necessary supplies. In this case, the nurse will need clean gloves, sterile gloves, normal saline, sterile gauze dressing sufficient to cleanse, pack, and cover the wound, an ABD pad, sterile cotton-tipped applicators, a measuring tool, tape, and pen. The nurse re-enters the room, performs hand hygiene, and identifies the client using 2 identifiers. The nurse has placed the supplies on a clean, dry bedside table and sets a waste receptacle in an accessible location. The nurse places the client in a comfortable position that allows access to the wound and maintains the client's privacy. The nurse then dons clean gloves. The nurse starts by gently loosening the tape while holding exposed skin down to prevent discomfort and skin trauma. The nurse removes each layer of dressing separately, assessing the color, odor, consistency, and amount of drainage using the acronym COCA. The nurse should also count the number of dressings removed to ensure that no dressings remain in the wound. The nurse then disposes of the soiled dressings. The nurse assesses the wound for tissue type, either granulation, slough, or eschar, stage of healing, and signs of possible infection. The nurse also palpates the peri-wound for induration, erythema, and temperature. Using the measuring tool without touching the tool to the wound, the nurse will measure the wound length, which is always measured from head to toe, and the wound width, which is measured from side to side. To measure depth, the nurse uses a cotton-tip applicator at the deepest part of the wound, placing her fingertips at the level of the skin. She uses the measuring tool against the applicator to determine the depth. The nurse removes gloves and places them in the trash receptacle. The nurse performs hand hygiene and lifts the bedside table to waist height. The nurse will set up the table with supplies arranged in the order in which they will be used, leaving enough room at the end of the table for opening and donning the sterile gloves. The nurse begins opening the sterile packages consistent with sterile technique. She will open the packages away from her and be careful not to reach over the sterile fields. In this case, each package is a separate sterile field. The nurse checks the expiration date on the sterile saline, and if open, the date and time. If opened within the last 24 hours, the nurse will lip the bottle by placing her palm against the label, holding the container above the waist, and pouring a small amount of liquid into the trash receptacle using a slight rotation movement. The nurse will pour a small amount of normal saline on 2 of the open 4x4 gauze packets, keeping the bottle at least 6 inches above the table and being careful not to create splashes or reach over other open packets. Next, the nurse will don sterile gloves. Open the inner packet by grasping the folds and avoid touching the inner surface. Grasp the edge of the first glove, touching only the inside of the glove. Lift up and away from the sterile field. Place glove on hand. Pick up the second sterile glove by placing gloved hand inside the cuff. Keep fingers inside the cuff with thumb extended as second glove is donned. The nurse will cleanse the wound by pulling the 4 corners of a moist gauze pad toward the center. She will gently wipe each section of the wound using a new piece of gauze for each pass. The nurse is careful not to touch the wound with the sterile gloves. Note that the nurse will cleanse from the least contaminated to the most contaminated area. In this case, the nurse cleanses from top to bottom because gravity pulls the drainage downward. Next, the nurse will squeeze excess fluid from the moistened gauze. She will then unfold and fluff the gauze to create a thin layer that will contact all wound surfaces. The nurse applies a single layer of gauze to the wound using a cotton-tipped applicator to assist with placement. The gauze is not packed tightly, as packing the gauze can restrict blood flow and impede healing. The nurse is careful not to extend the moist dressing over the skin to avoid maceration of surrounding tissue. The nurse applies dry, sterile gauze pads over the moistened gauze to absorb excess moisture and drainage. Next, the nurse will place an ABD pad over the dry gauze with the blue stripe up. The nurse then secures the dressing with tape on all 4 sides. She must be careful not to use excessive lengths of tape to avoid client discomfort, but must ensure that there is no gap between the dressing and the skin. An alternative method for securing the dressing would be to use Montgomery straps. The nurse will label the wound by writing the date, time, and initials on a piece of tape and then place it on the dressing. The nurse will remove and discard her soiled gloves and clear off the bedside table. The nurse then assists the client back to a comfortable position and assesses the client's tolerance of the procedure. The nurse performs safety measures such as placing the bed in the lowest position, placing the call bell within reach, and ensuring the bedside table is accessible to the client. The nurse performs hand hygiene and thanks the client. The nurse will document date, time, wound and drainage assessment, wound measurements, type and number of each dressing used, and the client's tolerance of the procedure.